The most common type of hair loss and where most of the data is the male-female pattern hair loss, which we call, androgenetic alopecia. That's where it's most beneficial, especially started early. So, someone coming in their 60s for treatment that started losing hair in their 20s, probably not the best candidate, but, those where it's relatively early on, I typically say, between 5 and 7 years of noticing changes in their hair. We have used it in other types of hair loss, but I think it's a little more inconsistent what the results are.
Hi, skin friends. Thanks so much for tuning into this week's episode of The Skin Reel. This week, I'm really excited to be joined by my colleague, board-certified dermatologist, Dr. Shilpi Khetarpal. She is a dermatologist and director of the Laser and Cosmetic Dermatology Clinic at Cleveland Clinic, and she is a leading expert in PRP. So PRP stands for Platelet-Rich Plasma. And most people, I think, listening have probably heard this term PRP, but you maybe don't really know what it means. We are going to take a deep dive into PRP, what it is, how it works, and when we use it, specifically for hair loss. Now, Dr. Khetarpal, she has been using PRP since 2016. She has performed over 2,000 procedures using PRP, and she even wrote a book, An Aesthetic Clinician's Guide to PRP. She's going to share all her knowledge about PRP and hair loss. If you have been struggling with hair loss and are wondering, is PRP really worth all the hype? You're definitely going to want to check it out. Dr. Khetarpal, thank you so much for joining me. I'm so excited to talk about PRP because not a day goes by that I am not asked about it. So thanks so much for being here.
Thanks for having me.
Yeah, so you literally wrote a book on PRP, right, for clinicians and dermatologists. So you're definitely an expert in this arena. Can you just let the audience know, what is PRP? Because we hear this term a lot, but I don't know if people really understand what it means.
Sure. So PRP stands for platelet-rich plasma. Essentially, we draw your blood and then it's spun in a centrifuge. So we take out the stuff we don't want, like your red blood cells, white blood cells, and then you're essentially left with your platelets in plasma. And the reason it's become so popular over the last few years are because platelets have a lot of growth factors in them. So normally they're involved in like our wound healing and, if we get injured, but they found that those same molecules that are involved in those processes are also involved in hair growth and, rejuvenating the skin. So in the last, I'd say probably 6 or 7 years, PRP has really come to the forefront as a way to restore hair, to help skin rejuvenation in combination with our traditional medical therapies.
I think a lot of people have heard of the vampire facial, right? Where you have PRP sort of spread on the skin, especially after things like microneedling. So PRP for hair loss, is that done in a similar way? Is it applied topically? Is it injected? What's the way that it gets to the hair follicles?
So after we, draw the blood, prep it, which is about like a 10 to 15 minute process, and actually get the PRP, we found that it's actually best to inject it. So we're injecting it into the scalp where like the stem cells are that stimulate our hair growth. So most people rate it like a 2 or 3 out of 10. We use cold air, we use ice. And we essentially inject, anywhere from 7 to 8 ml. So like a relatively small amount into the areas where they're thinning or they want to promote hair growth. So people would describe it as like a little bee sting. They might feel pressure for about 30 minutes after. But a lot of patients do it like on their lunch break. They can resume normal activity. They can like shower that day. Most of them don't notice any, difference. And if they do have a bruise, it's usually covered by their hair. And we found that, it works best as done as like a series of treatments. So typically it's like, 3 visits about a month apart. I'll do like maybe a 4th treatment at month 9 or 6 months later, and then just like a yearly maintenance. And, if done at the right time, so, usually if it's started within, say, 5 years of their hair loss, we can usually get that hair back. We can make the existing hair thicker. We know it's kind of slows down shedding and also grows more hair. So most of our patients, both male and female, have been very happy with it.
I have done it to myself, and I'll say we mix ours with a little bit of lidocaine because it does burn. Once my nurse forgot to do that, and I felt the difference for sure.
We do that also. I'm sorry, I left that part out. But I think, the ice, the cold air just helps to distract. And then, usually the pinches aren't so bad, but it can burn a little bit. But, as they say, no pain, no gain. Now, most people come back for their, additional treatment. So it must not be that bad.
I think everyone understands. It is a needle. The first ones can be a little spicy, but then the numbing really helps with the others. So, yeah, can this work for most types of hair loss, or is it best for certain kinds of hair loss?
So, the most common type of hair loss and where most of the data is the male female pattern hair loss, which we call, androgenetic alopecia. That's where it's most beneficial, especially started early. So, someone coming in their 60s for treatment that started losing hair in their 20s, probably not the best candidate, but, those where it's relatively early on, I typically say, between 5 and 7 years of noticing changes in their hair. We have used in other types of hair loss, but I think it's a little more inconsistent what the results are. We talk about like telogen effluvium where people have massive shedding, say after weight loss or after delivery, if they've had a baby or stress. It tends to be a little inconsistent there. But I used it in, mostly in these male female pattern hair loss. And most of them are on some sort of other medical treatment. And the combination of both seems to work very well.
I'm glad you brought up that they're also on other medical treatment because with hair loss, I feel like it's not just a one thing that fixes it all or cures it all. A lot of times it's doing several things, including at home and maybe some supplementation. So, what is sort of your ideal regimen for someone who has hair loss and they want to get PRP? That's what they're doing in the office. Should they be doing things at home as well?
Yeah, absolutely. So, it's starting very simply. Even if they don't have any dandruff or anything, I do recommend a medicated shampoo, either like, Head and Shoulders has zinc in it, the zinc pyrithione, or ketoconazole, which is the generic for Nizoral. We know those shampoos have anti-inflammatory effects. So they just stimulate hair growth, even in people without dandruff. So even if women use it once a week or if men want to use it every day, I typically have them do that. In terms of topicals, if they're open to doing topical minoxidil, either liquid or foam, that can be helpful. A lot of women find that it messes up their hair. So sometimes we'll just kind of skip the topical and then go straight to oral medications. Honestly, my favorite medication in men and women, which I feel like I'm not alone as a dermatologist, all of us really like it, is oral minoxidil. So, in low doses, it can really help to stimulate hair growth and decrease shedding and make the existing hair thicker. So, in an ideal world, a medicated shampoo a couple times a week, oral minoxidil, and then add in some PRP. I've had people that have gotten 30 to 40% improvement and, pretty easy regimen to stick with. Minoxidil is now cheap and generic. It's not messing up their hair. The PRPA visits are pretty quick, 20 minutes. We have them in and out. So that tends to work best. If they want to do more, there are light treatments they can do, the caps, the helmets, so on and so forth. And there are some supplements, but those would only be things if they really want to. I think if you're doing too much, it just gets kind of burdensome and hard to keep up with everything.
Yeah, absolutely. I love oral minoxidil and it's so affordable, so inexpensive. I mean, truly pennies for the pill, which is kind of nice because PRP, of course, not covered by insurance. So that is sort of a cash based thing. But I sort of make it make sense by, derm math, right? I'm paying pennies for my minoxidil. So paying a little bit more for the PRP. And are there actual studies, right? Like as doctors, we always want to make sure we're recommending stuff that has data. I hate to tell people to do something when there's really no evidence. Is there good literature and data on PRP for hair loss?
There is. Each month, each year, there is more and more literature coming out supporting its use. Most of these studies are done as a monotherapy, meaning they're not patients who are on your medicated shampoos or oral medications. They're doing PRP by itself just to remove any like confounding factors. But yes, it works. It's not magic. It's not meant to replace a transplant. It's not going to get the hair we all had in our teen years, but it does help. It can give you 10, 20, 25% more hair growth. It can make the existing hair thicker. It just kind of wakens up the hair follicle. So yes, there's a lot of data. It is very safe and effective. It's all your own stuff. We're just kind of taking what we want, discarding what we don't want, and not really adding much to it. It's a quick procedure. And I think almost always, as long as you're, picking the right people for it, they're very happy at the end. And I think photographs can show that. And most of these people I treat with PRP are very motivated to do something at home too. But yes, I think each month there are new studies that I'm always trying to keep up with for PRP in hair.
Yeah, absolutely. And we're seeing it in other specialties too. I know ortho uses it a lot for joints, being looked at for wound healing. So lots of cool stuff coming from that. Are there anything that can influence the effectiveness of PRP? Some of the criticism PRP might get is that it's variable, right? We're living human beings and our platelets aren't always the same day in and day out. So, yeah, can you speak to that?
So I think a couple of things. We know hydration plays a role. So if you're very dehydrated, you're not going to get a lot of plasma. If you have less blood and plasma, you're going to have less platelets. So I encourage all my patients, hydration the first 24 hours prior to your treatment is very important. There's some mixed data about taking like aspirin or things that could affect your platelets if they're able to avoid it to hold off on that. We also know, after you're sick or something, your bone marrow, where all these white blood cells, red blood cells, platelets are produced, might not be as active as it is when you're healthy. So, maybe not doing it when you're sick or on steroids, things like that. But for the most part, the average person, if they're hydrated, they're otherwise feeling well, most medications that doesn't interfere with the platelets, we can usually get enough, a meaningful amount to improve. I would also say there's a lot of variability from what the practices carry. Like, the systems that are best for ortho maybe aren't the best for hair. So that comes down to knowing what you're getting. And, there's a lot of like things thrown out like PRF, PRFM. Those are just different platelet products. Some are like a gel or, matrix. And I think ultimately PRP or platelet-rich plasma is where all the data is for hair and skin. And we're still learning more about the other platelet forms like PRF, PRFM. And there's maybe one or two studies for those supporting, for hair and skin. But sticking with PRP where we have, decades of data is really where the science is.
Absolutely. What about age? Does that influence who you would do PRP on, knowing that as we get older, maybe our platelets aren't as robust with growth factors? Or do you still feel like people can get benefit from it?
I do think there's benefit there. You're right. It does vary each day and by each decade, we may lose more. But ultimately, I use more like the duration of hair loss as a cutoff. So, within that 5 to 7 years, I have people in their 60s, 70s doing PRP with good results. So we encourage hydration as much as we can to get the best blood draw we can. And then, using a system that maybe gives a little more blood. So we use one of the 30 ml tubes versus some that are maybe 8 or 10 ml. So we have more blood. More blood gives us more plasma, more platelets. And then we have, more to work with.
It's more how much hair and how long have you lost that hair, right? If you've been nearly bald for 40 years, regardless of your age, that's going to be much harder to treat than someone who's maybe 65 and noticing thinning.
Yeah. And I also tell people, doing it by itself, you're not giving yourself the best chance to succeed. Hair loss is multifactorial. And if you're not treating each of the different mechanisms, minoxidil helps the blood vessels. The shampoos are anti-inflammatory, platelets are the growth factors. They all work together synergistically. So it's like 1 + 1 is 11, not 2. And they just get better results the more they're doing.
Yeah. And I would also probably add just diet too. I know some people might be on a very restrictive diet, maybe low calories or just restrictive on what kind of macros they're eating. And I find that that sometimes can affect hair loss as well.
A lot of people who are on these GLP-1s for weight loss, mostly less so diabetes, if they're really restricting their calories, I think that ultimately could affect the hair. It can affect their platelets. It can affect all aspects of their body. So just making sure that they're maybe not actively losing 50, 60, 70 pounds, wait until things are more stable before they, undergo a treatment like PRP.
I feel like hair is so responsive to stress and trauma. It's like the first thing to kind of give up and go. So if you are experiencing stuff like that, maybe try to weather that storm or get down to your ideal weight where you're not rapidly losing it, because sometimes that can be a little bit of an uphill battle. What about any risk with PRP?
If someone has like a active disease, like say hepatitis or HIV, we generally don't recommend it just because there's blood and, potential for needle sticks. Other times, if they're on certain blood thinners, we have to be careful or things that could affect the platelets. Someone with very low platelets, like once we had to turn someone away that had something called thrombocytopenia, if their platelets are critically low, you don't want to be taking them to do something like this. But otherwise, for the most part, it's rare that we aren't able to do it. If someone has like an active skin cancer or something, maybe getting that addressed first. But aside from that, I just did it recently in someone that was pregnant. It's all your own stuff. We're just kind of putting it where we want to use some of those growth factors. So I think very few and far between circumstances where, we don't do it.
I'm glad you mentioned pregnancy. I mean, most of the time, I feel like my pregnant patients really love their hair. But yeah, it is safe during pregnancy. It's your own platelets. We're not adding or doing anything.
Yeah, I had this patient she had to stop her entire hair loss regimen. And she had some pretty significant hair loss. She had to stop everything. So she was like, what can I do when I'm pregnant besides taking her prenatal? I'm like, well, we can try PRP, if anything, maybe some of those fetal growth factors would be more effective than the ones we normally need. And yeah, she did just fine with it. So TBD how her results are.
Great to know and kind of boost that hair growth because most likely there will be some shedding after delivery, right? You mentioned that really the side effects are low, and I totally agree. I would just mention though, because it is blood, I'm sure you saw those kind of scary reports of people being infected with HIV from med spas a few years ago where the blood wasn't handled appropriately. So I would say just make sure you're going to a reputable place that's taking precautions because this is human blood that we're dealing with. You want to make sure you're only getting your own.
Right. So, we have a system where we spin the patient's blood in their room or in at one of our locations where the centrifuge is in our lab. We label it, we show the patient, just having those extra measures to make sure nothing gets mixed up, especially in a busy clinic where sometimes multiple patients are getting it. Yes, I think you're right. Making sure you're going to a credible place where everything's clean and they have a way of following each person's product. Absolutely.
You don't want that getting mixed up for sure. What about stem cells and exosomes? Is PRP a part of all that? And how does it fit into this whole like regenerative medicine milieu that everyone's talking about?
Sure. So, I think PRP was the start of it. This whole regenerative medicine is a huge category now where we have stem cells, we have exosomes. Stem cells are really the precursor of everything, of every cell we have. The problem is that you could only get them from your bone marrow or your fat or placenta. So, actually being able to get someone's stem cells, I think fat is the easiest place, but not everyone wants to undergo like liposuction to get those stem cells. So, there's a few studies that show, they did liposuction, they were able to get the stem cells, and it's a pretty meticulous, long, expensive process to get them. But when they did inject them, people did very well and there was no issue. I don't know if that will be commercialized just because it's difficult to get them. I think we are going to see more with exosomes. Exosomes are basically these little packages of material that allow cell to cell communication. So they can tell our cells to grow hair or to stimulate new collagen. They basically communicate with our cells. All of our cells have exosomes. PRP has lots of exosomes in it. The problem right now is that our FDA says there are no exosomes approved for injectable use. There are some companies that have done some good data on a topical exosome preparation. People may have heard of the company Plated. Plated uses pooled platelets, so people donate their blood. They kind of take all the platelets out, irradiate them, get all the exosomes, and they have it in a serum. It's pretty expensive. I think 3 months supply is around, give or take $300-$400, but they do have good data there. There's not a lot of data in the exosome world for hair or skin right now. I think as time goes on, we will know more. But I think ultimately the most data is with PRP. There are exosomes in PRP. I think in the future, in the next few years, we'll see maybe an additional step to get your own exosomes from your own blood instead of using someone else's or animals or a plant, actually getting your own and then using those in more concentrated forms to grow hair, to combat signs of aging, things like that.
I feel like people just need to know there are no FDA approved injectable exosomes at this time. So that's something I think we'll see in the near future for sure. But yeah, right now, just the topical. I've used the plated exosomes for my hair. And again, I find it works alongside doing all those other things as well.
And, and no one's on like a head-to-head trial. Like you would say topical minoxidil, your topical exosome, how does it compare? It's just one more thing to do. And I think, these require like topicals require a lot of compliance. A lot of women, like I don't like to put something on my scalp every day. I don't wash my hair every day. So it just becomes, a little bit difficult. But I think exosomes are kind of the next step of how we can combat signs of aging with our hair, with our skin. And I think that it's a really exciting future for what's to come.
Are you familiar with platelet-derived growth factor injectables that are out there? And how does that compare to PRP?
I'm aware of some of them that are basically made in a lab from like recombinant yeast. It's like this platelet-derived growth factor. Again, it gets into a sticky FDA area. Like if you apply it topically or after microneedling or, after a laser, sure, that's fine. But injecting it into someone's scalp, is it approved? Are we going to run into problems? It has a lot of potential. I know topically after certain procedures, we've used it and it does very well. I personally have never injected it and I don't think there's a lot of data out there. I would imagine that it would help, but I think we just need more literature before knowing how to use it safely for hair.
I agree. I've kind of played around with it too, but it makes sense, right? Like if we're taking the growth factors from our own platelets and then if you can pull together exponentially more, it does make sense that it would work. But yes, like still TBD on how best to use and the safety on all of that.
And, I think it'll be interesting too, whether it's used by itself. Is it used in the place of PRP or with PRP? How best to get the best effects. But I think it has a lot of promise. And I think it's just still too early to know safety, efficacy, best practices when it comes to using those products.
Yeah, for sure. We definitely have the best data and safety with PRP for sure. Do you ever inject it in the eyebrows?
I have, some of my people doing it for hair. I've done it in the beard. I've done it in the eyebrows. I think it definitely helps. It's a little uncomfortable, but it's just a little poke. And some men who want to thicken up their beard, we've done it there too. So I think it has a lot of potential. I have a lot of repeat customers. Almost everyone that starts their series does come back for like their yearly maintenance. So it's definitely something exciting and just something we can offer that's not surgical.
I've used it for eyebrows. Yeah, for men who want just a thicker beard, it can be super helpful. So it's not just limited to the hair on the scalp. Very cool. Well, this has been super fun and educational for me. Could you leave us with your top 3 pearls for someone who is thinking about getting PRP? What should they know or think about?
So I think a few things. Number one, are they willing to do some treatments at home, whether it be topical, oral, kind of commit to that? Number two, how long has their hair loss been going on? Is it truly in the last 5 to 7 years? Is it going to be a reasonable result? Will they be happy with the result? And then I would say the third is long term. Are they willing to stick to the plan? Because we know, like anything, if you one day stop all your medications or stop it, things are going to go back to the way genetically they're predisposed. So I think just are they willing to commit to something, stick with it? And just like you brush your teeth every day, are you going to do X for your hair? So as long as, it's yes to all of the above, absolutely go for it. And then, find someone reputable who has experience with it, who is comfortable doing it. Dermatologists are truly the expert on skin, hair, and nails. So they can look for a board certified dermatologist near them to kind of come up with a comprehensive plan that's best for them.
I get this a lot from my patients, and you probably do too, where they sometimes get frustrated that it's not a cure necessarily when I say, no, you do have to continue on it. But I do find that once you get through that first 3-month series of treatments, and then you can space it out pretty much annually, that's pretty manageable and doable, I think, for most people.
Yeah, and I tell them, we just make it part of our regimen, just like we wash our face every day, or we brush our teeth. This is something we're going to do every day at home. And most people, it's pretty simple. And we try and keep it to like the least amount of steps. And it seems to work well for most.
Yeah, absolutely. And like you said earlier, people who have hair loss are usually really motivated, right? Like they really want it. They want to do everything they can. So lots of great advice, Dr. Khetarpal. I know people are going to want to find you or follow you. You've got a great presence on social media. What's the best way for people to find you?
I'm a dermatologist at Cleveland Clinic. If anyone ever wants to see me in person at Cleveland Clinic, or I'm on Instagram, it's SkinDocSK.
Amazing. I will definitely include that in the show notes. And thank you so much for joining me.